All right, it is Thursday, so that means Ohio's new COVID numbers are out, and we're seeing a slight bump in total cases week over week. The state reporting this week 25,280 new cases over the last 7 days. That is more than a 1,000 case increase from our number last week. It's also above the 3-week rolling average, which is just over 24,000 cases a week.
So let's remember the FDA signed off on the updated boosters for Pfizer and Moderna yesterday, but here's the thing, no one can get them yet. Senior health correspondent Monica Robbins, okay, we need to break this down because I know there are people going, wait, it's available, but wait, why can't I get it?
Yeah, Monica, good afternoon to you. We're doing so well with cases here to 4, and now the bump. You have a theory.
Yeah, what happened this week and last week? Kids went back to school.
Bingo.
So we put everybody in a room together, and don't be surprised, folks, it's probably going to happen again next week. So the good thing, though, hospitalizations, however, had a slight dip. So that is promising. Let's hope that keeps going. Now, the CDC Vaccine Advisory Board meeting today and tomorrow. We're waiting for the CDC director to sign off on the new Omicron booster shots from Pfizer and Moderna. Here's 3 things you need to know. So who can get it? Well, we're waiting to find that out. Wouldn't be surprised if the initial doses are offered to the elderly and most vulnerable. Pfizer says it can ship 15 million doses by September 9th, by the way. Now, those who've had their primary doses of original vaccine are eligible for the new boosters as long as their last shot was more than 2 months ago. For the young and the healthy, depending on whether they're around people who may be at high risk, doctors tell me they could reasonably wait until October or November before getting the boost to be prepared for the holiday season. These shots are age-specific, 12 and over for Pfizer and 18 and over for Moderna. And in the past, the CDC has recommended waiting 3 months after an infection before receiving another vaccine or booster. If you have yet to be vaccinated, however, you have to get all of your original shots first.
Wow.
So I know that there are some obstacles relating to the vaccine. Walk us through those.
Yeah, we're seeing quite a few of those. Money, definitely a big one. The government pandemic funding drying up. Congress is holding on tight to those purse strings right now. States were promised FEMA reimbursements with a $550 million in vaccination spending this year. Last year, it was $8.5 billion with a B. And while providers are still supposed to vaccinate for free, the feds ran out of money this spring to cover the shots for the uninsured, which may make it somewhat difficult for people to get one.
Okay, I keep hearing people say this. I have vaccine fatigue. I have virus fatigue. To that, you say what?
I do too. That's what I want you to know.
Well, that's reassuring.
That's pretty collective.
You are not alone. However, this is a huge issue. Surveys show less than 1/3 of Americans are concerned about COVID. And that is definitely made clear by the numbers of people who didn't get those old boosters. Demand for shots are likely going to depend on the severity of this cold and flu season because, as we know, as weather gets colder, we're likely going to see a COVID surge, and epidemiologists are predicting another 100,000 deaths by spring. But if we get a rough flu season, which is also predicted, things could get very worse. Scientists say this year, American deaths from COVID were 80% higher than Canadians and 30% higher than the European Union. Think about that for a second. And let me bring it back home to Ohio. Here's the clearest evidence these vaccines work. Since January of 2021, more than 75,000 people who were unvaccinated were hospitalized, compared to 5,500 who were fully vaccinated. And nearly 25,000 unvaccinated Ohioans died from COVID, compared to 1,300 fully vaccinated. Again, these vaccines were never meant to prevent you from getting the virus. They are meant to prevent you from dying from it. And the same goes for flu vaccines. So if you think about it, please get one of those too in late this month, October, November.
Those are stark numbers.
Yeah,
You're talking 25,000 to 1,300?
Yes,
Yeah.
I think the last 45 seconds of what you just said there is people's takeaway. Because I do think a lot of people misheard, or maybe the messaging was bad. A lot of people thought, well, if I get the virus or if I get the vaccine, I'll never get the virus.
Yeah, no.
What it does is it keeps you out of the hospital and alive, and those numbers drive that home better than anything we can say.
Yeah, I mean, that's the whole point. No vaccine was ever meant to prevent you from getting at least
sick
these
at all.
vaccines that I'm talking
Just
about.
keep you from getting less sick.
Yes, they are meant to, and the flu vaccine does the same thing, so that's the whole point of it.
Monica, great information.
Yes.
Thank you
Sure.
very much.
Thank you.
Thanks.